This lecture is about the medical nutritional therapy for diabetes mellitus, and it is concerned with type 2 diabetes. Type 2 diabetes is the most common form of diabetes since it accounts up to 95% of diagnosed cases. The management of diabetes mellitus is based on what is called needs: N for nutrition, E for exercise, E for evaluation of blood sugar, D for drugs, and C for lots of study about your disease. Nutrition is a cornerstone for controlling diabetes since it regulates carbohydrates, fat, and protein homeostasis for the safe, effective use of insulin and oral hypoglycemic agents. The role of a nutritionist in management of diabetes not only to control their blood sugar through right choices of food, but also to change their lifestyle and behavior so will it control their blood sugar. Obesity increases the risk of diabetes, dyslipidemia, hypertension, and coronary heart disease. Obesity is measured by what is called the body mass index, which is the weight measured in kg divided by the height measured in square meter. These have certain limits which are different for Asians because they have a different body configuration. So we should measure what is called the waist to hip ratio, which is the waist circumference. For men, it should be less than 40 inches, and for women, it should be less than 35 inches, which is giving a better idea about the obesity more than the body mass index. And as it says, the longer the belt, the shorter is your lifespan. To make the right choice of food, we should depend upon what is called the food pyramid. And we can notice that the carbohydrates are making the base of the pyramid. In diabetics, the food pyramid is different from those without diabetes, in which the base of the pyramid is based on water. When choosing food for diabetic patient, we should depend on the glycemic index of food, and food that have low glycemic index will have little effect on body sugar level. However, glycemic index can be affected by certain factors like moist and deep frying. So the way to cook the food can affect the glycemic index. When choosing carbohydrate, we should use those who are resistant and that release glucose slowly. Even for a protein, it's better to use those with a slow turnover. However, the quantity depends on certain metabolic needs, as the protein should be increased in case of infection and post-major surgery, while decreased when patients have complication of the kidney like nephropathy. As I previously mentioned, for the use of soya as a source of protein for coronary heart disease, it is also beneficial for those with diabetes as it decreases the resistance of insulin. Fibers are important for diabetics in its two types: the insoluble because it helps in weight reduction, and the soluble because it delays the absorption of glucose and reduces the cholesterol and triglycerides. Micronutrients are prescribed for those with restricted diets only. Meals of diabetics are composed of 3 main meals and 2 small mid-meals or snacks. The snacks should be either fruits, coffee, green tea, herbal tea, or light soup. Each meal should depend on the plate method, in which half of the plate is composed of vegetables and the other 2 quarters are meat and carbohydrates. However, there are 3 foods that can be consumed by diabetics These are the vegetables, the clear soups, and the skimmed milk. Now for the MNT for diabetics with comorbidities. Comorbidity means that patients have diabetics and other disease. Example, cardiovascular disease. Those patients should have hemoglobin A1C as close as those to normal, but try to avoid hypoglycemia. The MNT should be high in fruits, vegetables, and whole grains and nuts. Besides, sodium should be decreased to less than 2 grams per day, and decreasing weight will be a benefit for those with coronary vascular disease and diabetics because it will reduce the blood pressure. Gestational diabetes is the development of diabetes during pregnancy, and after delivery, the blood sugar will return to normal. However, that they are at risk to develop type 2 diabetes postpartum. Therefore, they should have a lifestyle modification to decrease weight and to practice exercise and regulate their diets. We should not rely only on MNT to regulate blood sugar. Exercise is essential since it reduces insulin resistance. To say diabetes is controlled, a patient should have the following readings. Hemoglobin A1C should be less than 7. Blood pressure should measure less than 130/80. The LDL should be less than 100 for a patient without comorbidity and less than 70 for a patient with coronary heart disease and diabetes. Triglycerides should be less than 150, and HDL should be more than 40 for men and more than 50 for women.